So, Scott, we mentioned improving the quality of life several times of our patients, and we can expand on this on several different ways because with the situation of healthcare in Canada right now, and the long waits, and in that time, what are we not accomplishing? And so we have that situation and putting out fires, as you mentioned at one point. So we have that, an improvement of quality of life today, and then the long-term improvement of quality of life by having stem cells today and 20 years down the road, how a patient may fare with or without stem cells, and comparing the two. Can you expand on that a little bit with me?
Yeah, I think certainly in my practice life, there's two basic streams that patients come in, and that is people that are in acute care or subacute care, and then people that are looking just to increase their quality of life. So I have a very high wellness-based practice where we're talking about diet and lifestyle and psychology and the three basic tenets that we talk about for health. And with the longevity and the quality of life, stem cells just fit so beautifully in there, and that we can more or less turn back the hands of time and give people almost a reset point where they can take it from that point and start into exercising better and eating better, and they can reap the benefits of feeling better and feeling rejuvenated, more strength, more stamina. And so I think that's huge. And I mean, let's face it, with the way healthcare is in I'm going to say North America, because I don't think it's just Canada, but certainly Canada. I'm a firm believer of trying to teach my patients and keep my patients out of the system, because I don't think the system is there for us. And wait times of a year plus in order to have any kind of like arthrosis replacement, I think is just dreadful, because the quality of life diminishes. The rehab becomes so much harder. Whereas if we have somebody as strong as we can, if and when the time comes that they do need a replacement, I just think the outcome is so much better. And I think my wife is case in point. I mean, she did end up having to have hip replacements. Hers was a congenital thing, which I mentioned before, that the joints were actually fused. So her hip sockets only afforded her about 5 degrees range of motion. And by doing the stem cells, and we made a conscious decision, we did the stem cells about a year before we did the replacements, which allowed her to get in probably the best shape that she's been in her life, and strong, so that when she actually did have the replacement afterwards, she was weight bearing and walking within 2 to 3 days, doing exercises that people would do at 6 to 10 months. She was doing at 3 to 4 weeks after the replacement, and everybody is still in awe of just how quickly she has recovered and to what level she has recovered. And stem cells were a huge part of that recovery. And then, so also if you're sitting waiting for, an orthopedic consult on a knee or a hip, there's ways that we can do all the evaluations. Dr. Zahra and her team can then look to see whether or not the person is a candidate for stem cells, and if they are, I would highly recommend making that investment. I've seen far too many patients in recent years, like the last 3 to 5 years in Canada, they wait for a year and a half in order to get a replacement, and they never recover. They are out of pain, but they certainly don't have quality of life, and they certainly don't have function. And with a few of my patients that have experienced stem cells in those situations, the outcome has been dramatically different than people that have not had stem cell therapy.
Right. Incredible. And we, just to clarify with Diana, we did stem cells in both hips prior to the replacement about a year later, and we did stem cells in conjunction with the replacement that also hastened the healing, which was quite incredible. And when we talk about the diminished pain, the increase in ability to do things that we weren't able to do previously, and then all of the sort of the roll down benefits, or all the benefits by default, because our patients are in less pain, they're taking less medications, in return they're sleeping better, they're less toxic, their quality of life, they're more energy. There's so many things by default, just from diminishing the amount of pain and increasing the quality of life, and how the psyche changes, and again, by default, how many aspects of the life changes. Would you like to expand on that?
Yeah, I mean, stem cells are such a unique process that it's all encompassing, and even if all that happens is you get stem cells put into a joint, as we know, the whole body's all connected and everything works together. They don't just stay in the joint. They travel through the bloodstream and get into other places, and yes, things like quality of sleep, just the psychological burden of not being in pain on a daily basis is basically a gift, that it makes, just makes so many changes in their life. So.